What are the things one should look for before deciding your hair transplant procedure? Hello, I'm Dr. Amit Singh. I'm a hair transplant surgeon based in Dehradun. REVERT Hair Transplant Center is the name of my clinic, and I have been doing hair transplants since the last 8 years. For those who are deciding to get their hair transplant done, before making your final decision, there are certain things you should make sure before arriving at any decision. First of all, hair transplant is a minor surgical procedure, and if done by a qualified doctor, it is a very safe procedure. So the most important thing you have to make sure before deciding your hair transplant is the qualification of the doctor with whom you are deciding to get your hair transplant done. Hair transplant is, as it is a surgical procedure, it will be best done by a qualified surgeon. The other specialty which is eligible to get to do a hair transplant is a dermatologist, a skin specialist. So you should make sure that the doctor with whom you are planning to get your hair transplant done should be a qualified surgeon or a dermatologist. The second important factor, hair transplant is a procedure which cannot be individually single-handedly performed by the doctor only. He needs some assistance. At least 3 to 4 assistants are required to get the procedure completed. So most of the clinics, they outsource their technicians. They call different technicians in different cases. That leads to a difference in the overall result. In our clinic, REVERT, we have our permanent technicians and staff, and they have been performing hair transplant with me. They have been assisting with me since the last 8-10 years. So make sure that the staff is a permanent staff and who is experienced as well. The third factor, because hair transplant is a minor surgery, it should be performed in a well-equipped operation theater. That operation theater should have all the facilities. It should be properly sterilized. The instruments should be properly autoclaved. Then only the procedure can be performed safely and we can give good results. And the other part that is important is the method that is being used in performing your hair transplant. So to explain the hair transplant procedure, I would like to divide it into 2 parts. The first part involves the method by which roots are taken out from the back side of your scalp, and the second part is the method by which those roots are implanted in the frontal area. So regarding the first part, there are 2 methods by which hair roots are taken from the back side of your scalp. One method is called FUE, which stands for follicular unit extraction, and the other method is FUT, which stands for follicular unit transplant. In FUE, individual hair roots are extracted one by one, and in FUT, a portion of around 1.5 to 2 centimeter width wide and around 30 to 35 centimeter length, a portion of the skin is surgically extracted, is taken out from the back side of the scalp, and from that part of the skin, individual hair roots are separated. So both the methods, we implant individual hair roots only, but the method of taking those roots out from the back side of the scalp is the only difference between FUE and FUT. So the second part is the method by which those hair roots are individually put in the frontal area for growth. So the traditional methods, the old methods, when hair transplant was started, was that the area where roots are to be put, the surgeon used to make slits or small holes, multiple holes in the front area of the scalp, and the technician or the assistant used to hold individual hair roots with the help of that forceps, and with the help of that forceps those hair roots used to be put in the individual slits or holes. In this traditional method, because of holding the roots by a forceps, and they used to be damaged, and by on putting those hair roots into the individual slits, some roots used to bend, they used to get damaged. So approximately around 20% of the roots were usually damaged while implanting them during the procedure. As you all know, science thrives on advancements. So presently the most advanced technique by which implantation is done is called DHI. DHI stands for direct root implantation. We use this modification of DHI in our clinic. The method we use is called feather touch hair transplant. Feather touch stands for that we need not touch the root aggressively. Feather touch means we have to touch the root only very softly. That leads to increased survival of hair roots. So to implant those hair roots in the front area, we use special instruments which are called implanters. Implanters are a pen type instrument where we load those individual hair roots inside the implanter, and we put those implanter along the slit which the doctor have made, and just like a button over the a pen or implanter, we push that button and we place those hair roots in the desired site and depth. So we don't have to manipulate or aggressively hold on to the roots while implanting. This leads to around 99 to 100% root survival. The second advantage of this technique is the out of body time. The time period when the roots are kept outside the body is also minimum, because it is a faster technique where we simultaneously can implant multiple roots. So the feather touch hair transplant presently is the most advanced hair transplant technique by which hair transplant is performed. We at REVERT do feather touch hair transplant only. We have been performing this procedure since the last 5-6 years, and we have around 95 to 100% growth rates. I hope the information which I have given to you in this video, you will find it informative, and that will help you in deciding the clinic as well as the method, the procedure by which you want to get your hair transplant done. For further information regarding hair transplant and other hair loss treatment, you can subscribe to our channel. You can also press the like button so that we can reach more number of people. You can visit our website, or you can message us on our WhatsApp. This is Dr. Amit Singh signing off.